Let's pick up on this now. Unemployed doctors in KwaZulu-Natal say there should be no budget cuts for the healthcare system and that an additional budget must be sought to hire over 800 doctors who are sitting at home nationwide. The doctors have marched to the KZN Department of Health today to hand over their grievances. Here's Newzroom Afrika's Nobuhle Modise with that report.
Unemployed doctors in the KwaZulu-Natal province have responded to last week's remarks by Health Minister Dr. Nobuhle regarding budget constraints being the reason why many of them are unemployed. The minister, in a press briefing last week, said there's simply no money.
I don't know if maybe it's an escape tactic to say that, or it's trying to run dilly-dally. There's no doctor who doesn't want to go and work in the rural areas. And also it's a lie that our starting gross, our annual salary is 1.2 million. It's a lie. You can go into the websites and you can Google grade 1 medical officer. You'll see how much we earn.
Many say they're willing to work in other areas and are not picky.
It's been very stressful, not knowing, not even having any hopes, because in KZN there's not many posts even being advertised. I've started applying to places like the Free State, Limpopo, places I haven't even ever visited, in my life. And I'm having been forced to apply to those places like that, so it's been very stressful, yeah.
Their memorandum is clear that cutting the budget in the healthcare system is lowering the nation's life expectancy.
We do believe that there might be an element of corruption, but also there's a huge element of mismanagement of funds, of which this has been in conjunction with our universities. They have known for a very long time how many doctors that they are necessary. And also, another thing is that as doctors, we are very much aware that we can be bailed out. There are always these ministerial funds that come out of nowhere, of which they are not willing to do for doctors right now. So it's not a matter of pockets, but it's a matter of priority.
The Public Service Association says poor management of funds has resulted in scores of qualified doctors failing to secure jobs.
The Department of Health seems to have failed, including the minister, because it's not our business that there is no money. The issues of corruption is them that need to be able to deal with it. What we are saying, we are disappointed that they are now reversing the gains of democracy. It is through the employment equity where we said we need more young black doctors. We've got them. They are on the street. It is a shame of them. That's why we are saying we can't be sending memorandum after memorandum.
Deputy Health Minister Dr. Modise says the doctors' plight is top priority in the department.
If we get budget cuts as health, if you just say 2% top slicing, 2% for Department of Health is a very big budget. It therefore affects us. So some of the things that are in your memorandum are issues that we agree on them.
Without giving a time frame for a response to the memorandum, all the Deputy Minister could say is that a solution to the current crisis of unemployed doctors will be delivered by Minister Dr. Nobuhle following his engagement with Treasury. For Newzroom Afrika on Channel 405, I'm Nobuhle Modise in Pietermaritzburg.